Welcome to Greece, medical students. You are standing right in the absolute cradle of Western civilization, the birthplace of medicine as we know it today. For this explainer, we're doing something a little different. We're going on what you might call ancestral rounds. We're going to set the stage and look at how your ancient predecessors championed what we now call lifestyle medicine. And they did it using nothing but their own observational genius to prescribe movement and really manage human health. So, you're studying medicine right here in the heart of the ancient world, surrounded by all this incredible history. But I want you to just step back in time for a second and think about a really foundational question. Before modern physical therapy existed, how in the world did the ancients prescribe movement? Imagine being a physician centuries before we had modern anatomical tools. No x-rays, no MRIs, none of that stuff was even a concept yet. How do you figure out what a patient physically needs or treat muscular ailments? Well, the answer is actually pretty amazing. It came down to their incredibly keen observation of nature, human habits, and seeing the physical consequences of our daily routines. And Hippocrates' foundational rule of homeostasis really hits the nail on the head here. Just listen to this quote. "Those that spring from fatigue yield to rest, and if originating in rest, they give way to exercise." Hippocrates, the father of medicine himself, believed that the human body was basically governed by primary elements. He focused heavily on fire for motion and water for nourishment. To him, health wasn't just, not being sick. It was this highly active dynamic maintenance of a perfect balance between the two. If you had way too much rest, well, you needed the fire of exercise to balance the scales. To really grasp the pathology of inactivity, we just have to look at how Hippocrates analyzed the nomadic Scythians. This is a fascinating comparison. On one side, you have the highly active Greeks who walked absolutely everywhere and did daily gymnastics. On the other side, you have the Scythians. They lived a totally sedentary lifestyle, spending almost all of their time just riding in carts or on horseback. And Hippocrates noticed something huge. Because they never walked, their bodies retained excess moisture. Their limbs became, in his words, flabby and relaxed, which led to some pretty severe joint weakness. It was actually so extreme that they required intense therapeutic burns just to tighten up their tissues. I mean, that is a dramatic but honestly brilliant ancient observation of muscle atrophy caused entirely by a lack of mobility. Now, what's so cool is how this ancient logic translates directly into actionable medical charts. Take this specific, highly tangible treatment plan for a patient dealing with dropsy. Dropsy is just an old medical term for severe edema or fluid retention. Notice what Hippocrates does here. He doesn't just tell the patient to go to bed and wait it out. No way. He takes a super active, lifestyle-based approach to literally dry out the excess humidity in the patient's system. He actually prescribes exercise to induce sweating. He adds really specific dietary tweaks, like eating hot bread dipped in oil and drinking thin white wine. He even deliberately restricts their sleep. It's a completely structured regimen where movement and diet aren't just suggestions, they are the actual medicine. Then, a few centuries later, the legendary physician Galen comes along, and he takes these early Hippocratic observations and systemizes them into highly specific rehabilitative prescriptions. Galen formalized what we would totally recognize today as physical therapy and sports massage, using the term frictions. And he didn't just tell people to just rub the muscle. Galen was incredibly rigorous. He categorized these frictions into three main intensities: hard, which he called dura, soft or mollis, and moderate, mediocris. He was literally customizing physical therapy, tailoring the exact duration, the specific technique, and the intensity to match the exact muscular weakness of the patient in front of him. But Galen didn't stop at massage. The guy was basically an ancient sports medicine doctor. He essentially wrote a medical endorsement for playing tennis. In one of his treatises on exercising with a small ball, he strongly prescribed the game of fives over the heavy gymnastics and wrestling that were super popular back then. And his reasoning is spot on. The ball game is a safe, full-body workout. It exercises every single part of the body, it completely avoids the massive danger of wrestling injuries, and it's accessible to patients of literally any age. At the same time, he completely roasts heavy gymnastics. He calls them dangerous, way too expensive to maintain, and inefficient, basically saying they leave huge parts of the body completely unemployed. All of this brings us to one of the absolute most profound statements you'll find in these ancient texts. Galen wrote, "The preservation of health depends on medicine, exercise, and diet. All constitute, as it were, links of one great chain." I want you to really think about that. He wrote those words nearly 2,000 years ago, and yet it is the absolute perfect summary of the holistic, interconnected, preventative care that you are being taught right now. You simply cannot separate the clinical medicine from the diet, or the diet from the patient's physical exercise. If just one single link in that chain breaks, the patient's health is going to fail. So I'll leave you with this final thought. How are you going to incorporate this ancient chain of medicine, exercise, and diet into your own modern practice? As you keep grinding through your rigorous medical studies here in Greece, literally surrounded by the ghosts of the very first great physicians, let the echoes of Hippocrates and Galen remind you of something incredibly vital. Sometimes the absolute most powerful prescription you can ever write for your patients doesn't come in a pill bottle from a pharmacy. It involves movement, it involves habit, and it involves a balanced lifestyle. Thanks for joining me on this explainer, and I really hope this gets you fired up to carry this ancestral wisdom right back into your own modern clinics.